the sexually transmitted disease. The sexually transmitted disease, we have different types of diseases included in the sexually transmitted disease. Let's see each of this. Each of the disease can be separately distinguished by learning about the organism and what type of ulcer is caused and whether the ulcer is painful or not, and the ulcer is associated with the lymph node enlargement and that lymph node is painful or not, and what is the microscopic appearance of that organism. Let's see each of this. First sexually transmitted disease is the syphilis, which is also called the hard chancre, whereas the chancroid is also called the soft chancre. There is hard chancre and soft chancre. The syphilis is called the hard chancre and the chancroid is called the soft chancre. Syphilis is caused by the organism Treponema pallidum, and the ulcer which leads to the which is caused by the syphilis is a round or oval shaped ulcer, and it is indurated ulcer. That ulcer is not a painful, but there will be a lymph node swelling will be there. The ulcer, that a painless ulcer is associated with the lymph node enlargement, even that the lymph node is also painless. When this organism is seen under the microscope, because it is a spirochete, it appears like a spiral shape, and in the negative background, that is dark illumination microscope is used to differentiate this organism. In that dark illumination microscope, this Treponema pallidum is seen as a spirochete. This spirochete appearance is seen in case of syphilis or the hard chancre. And moving on to the soft chancre, which is also called the chancroid. The organism which is leading to this chancroid is called the Haemophilus dicraei. Haemophilus dicraei causes soft chancre, and the ulcer is undermined edges will be there, and it is a non-indurated ulcer. There is a difference between syphilis and chancroid ulcers. These are non-indurated, and sometimes it may be a multiple ulcers, and one and another ulcer comes in contact, and it appears like a kissing ulcer. This multiple ulcers, when comes in contact with each other, it appears like a kissing ulcer. This is in case of chancroid or the soft chancre, and these ulcers are painful. These are the painful ulcers with the lymph node enlargement. Mostly the lymph node involved is the inguinal region, as the genital organs is involved most commonly in case of sexually transmitted disease. The organs is drained by the inguinal lymph nodes. So inguinal lymph node enlargement will be there, which is also called the inguinal bubo. When the Haemophilus dicraei is seen under microscope, it appears like a railway track appearance or fish of school appearance. This is the fish of school or the railway track appearance. These are arranged in a straight line. So this organism is identified as Haemophilus dicraei, which leads to chancroid or the soft chancre. Next, moving on to the lymphogranuloma venereum and LGV, that is caused by the organism Chlamydia trachomatis, and the ulcer will be a single ulcer. Even that ulcer is a shallow ulcer which heals rapidly and which is not painful, leaving behind only the lymph node will be present at the time of presentation. When the patient says the ulcer was present, painless ulcer which was present earlier and heals rapidly and resolved itself, but the lymph node, which is a painful lymph node, will be persistent. This is the presentation of lymphogranuloma venereum and caused by the organism Chlamydia trachomatis. Because of this lymph node enlargement, this is the inguinal lymph node in the thigh, it forms a fold-like thing. So that is called the groove sign. Groove sign will be positive in lymphogranuloma venereum caused by Chlamydia trachomatis. Next, moving on to the granuloma inguinal or donovanosis, and this disease is caused by Klebsiella granulomatis. Granuloma inguinal is caused by the granulomatis, Klebsiella granulomatis. The ulcer will be a red and beefy ulcer. It is a red beefy ulcer, even though it's a red color, and it is not painful. And the lymph node is seen as a pseudo lymph node because the lymph node itself not enlarged. It appears to be the soft tissue around it is swollen, so it is called the pseudo bubo. When the original lymph node is enlarged, then it is called the bubo, but the soft tissue around it tends to be enlarged, then it is called the pseudo bubo, which is seen in case of granuloma inguinal or donovanosis. When seen under microscope, this Klebsiella granulomatis appears like a safety pin appearance, and which is also called the Donovan bodies. Donovan bodies, so the disease is called the donovanosis. This is the safety pin appearance. The terminal ends will be stained, which is seen in the Klebsiella granulomatis, which is a granuloma inguinal or donovanosis. Next, moving on to the gonorrhea, which is caused by the organism Neisseria gonorrhoeae, and the patient present with the urethritis. They will not present as an ulcer, they present with the urethritis, burning micturition or whitey discharge from the urine, or the presentation in case of gonorrhea. Next, moving on to the viral infection, which is herpes. It is caused by the both herpes simplex 1 and 2 virus. Initially, it appears like a blister around the external genitals, and that blister later on develops into an ulcer. That ulcer is very painful, and it also gives rise to lymph node enlargement that is too painful. So in case of herpes, the ulcer blisters to ulcer, and that is painful, and then lymph node is painful. These are the common sexually transmitted disease. Let's see once again. When the ulcer is painless but the lymph node is present without pain, then it is called the syphilis. When the ulcer is painful, then we have to see whether the lymph node is present or not. When the ulcer is painful, then it may be due to chancroid or soft chancre and herpes. When the lymph node is also painful, then confirm it is herpes. When the lymph node is present but it is not painful, then it is chancroid or the soft chancre. And in case of LGV, the ulcer is healed and not seen, whereas the lymph node is present, only painful lymph node, then it is called the LGV. And in case of granuloma inguinal, the ulcer will be red colored, but that is not painful with the pseudo lymph node enlargement. Then it is called the granuloma inguinal or donovanosis. When the patient presenting with an urinary tract infection symptoms, then it may be due to gonorrhea.